And we're going to continue our discussion on the skeletal system. And today I want to talk to you about the cranium. The cranium is just a fancy name for your skull. And you can see your picture of the skull here on the screen. There are two sets of bones, two ways that we can categorize bones that are in the cranium. We can talk about cranial bones, bones of the head, the back of the head, the top of the head, the side of the head, and then facial bones, which are just what they sound like, bones in your face. Cranial and facial bones are all joined together by sutures, we call them, immovable joints. These are joints that allowed no movement at all. Remember the last time we spoke, we talked about joints. And one of the types of joints, allowed no movement. There's only one bone in the cranium that moves, and that is your mandible, your lower jaw. It forms a joint with another bone, and it's called the temporomandibular joint. So it forms this joint with your temporal bone, and your maxilla is in that area too. And it forms this temporomandibular joint, or TMJ. You might have heard someone that has TMJ pain. That's pain of that joint that can develop. So, bones of the cranium first. Functions. Bones of the cranium protect the brain. They're attached by sutures. There are 8 bones in there. They're flat bones. There's a frontal bone, 2 parietal bones, an occipital bone, 2 temporal bones, 1 sphenoid bone, and a hole, or I shouldn't say hole, there are holes, but there is one hole that we're going to name in particular called the foramen magnum. Holes in bones are called foramen. They have various functions. They help to let things get through the bone, like blood vessels and nerves and ligaments. But the foramen magnum is the largest foramen in our body. It's on the underside, the inferior surface of the cranium, and it occurs in the bone that is called the occipital bone, and this is where the spinal cord passes from our lower body through our cranium and attaches to our brain. We'll show you pictures of all these things. So, taking a look at here, in this goldish yellow is the frontal bone, just one of those. And there's a suture there called the coronal suture that joins the two together. You see how these are little jagged lines. Then you have the parietal bone. There's one on each side of the head. They join together in the center. Occipital bone here in the back and all the way down into the base. Temporal bone in orange here on the side, and you can think of the sides of your head, you call them your temples, and that's because there's temporal bone there. And those are the bones that we talked about of the cranium. Here's another way of looking at it. We take the top of the skull off. We just sawed it in half, and we're looking straight down in the middle. This hole right here is the foramen magnum. This is where the spinal cord would come through the cranium from the body and attach right on the lower side of the brain. Largest foramen in your body. And coincidentally, humans are the only animal that has a foramen magnum directly underneath of their skull on the lower side. If this was a dog, for example, or a deer or a cow or whatever, the foramen magnum would be here on the back side because their spinal cord is not vertical like ours. Their spinal cord, since they stand on 4 instead of standing up on 2 feet, their spinal cord is horizontal in comparison. Here's another look at the underside of the cranium. There's that foramen magnum. And here's parietal and temporal bones here in the green and in the orange. And back here, this brown one, this is the occipital bone. So we're talking about the bones of the cranium first. Now, babies. Let's talk about babies for a few minutes. Now remember that I told you earlier during development of bone, that bone starts out as cartilage, and then as minerals are put into that bone, that cartilage is turned into bone. And this starts before you're born and continues after birth. Well, you've probably heard it said that babies have soft spots when they're first born in the top of their heads. And this is an area where that bone has not fully formed from cartilage, and so it's softer, it's more flexible. And you can physically see that on a newborn baby's head. And even for some months after birth, you can look and you can see that, depending on how much hair they have, if they don't have much hair, you can see this indentation in the cranium where that soft spot is. And you can also feel that it's softer. Don't push on that soft spot, because that could go straight through if you used too very much force with a sharp object right into the brain. These soft spots are called fontanelles. Here's the big one right here on the baby. This is the frontal bone, and this is the parietal bone. And so where these two bones, or two parts of the parietal bone and the big part of the frontal all joined together, there's a soft spot there. It's the anterior fontanel because it's toward the front. There's also a posterior smaller one back here where the parietal bones and the occipital bone join together. So those soft spots are important because that cranium needs to grow as the brain grows, and those soft spots are where that bone's still growing together and allowed that growth to happen. They totally close within about 24 months after birth. Facial bones. Now, let's talk about the bones of the face. The maxilla, there are two bones that form the upper jaw, and the mandible, lower jaw, only one bone. There's nasal bones that form the bridge of your nose and your cheekbones, which are called your zygomatics. There are also some additional bones inside the nose. We're not going to worry about those. So taking a look here, here's the frontal in gold. Here on this side, you can barely see, it's kind of fuzzy, sorry about that, are the parietals. Here's the nasal bones, two of them side by side that form the bridge of your nose. The rest of the nose area here, this was cartilage, so in someone that dies, this does not remain, this decomposes. Here's the maxilla, this upper jaw, this gold, all the way up beside the bridge of the nose into the eye socket, holds the upper teeth, or dentition it's called. Then over here on one on each side are your cheekbones. The zygomatics forms a part of the eye orbital, and of course your cheek goes back and attaches to the temporals. Oops, sorry about that. And then down here, the last bone, the mandible, that forms this TMJ joint up here with the temporal bone that allows that mandible to move. The mandible can move up and down, but you can also move it to some extent forward and backward and side to side. So it's a very flexible joint. And the mandible, of course, holds the lower teeth, or the lower dentition. Here's another way of looking at that same thing from the side. Here's the mandible in red. Here's that TMJ joint right back here with the temporal. This part here does not form a joint. Here's your zygomatic and your maxilla and your nasal bones. And that is the end of what we want to talk about today. So we've talked about two main classifications of bones: the cranial bones, the facial bones. Remember, the big purpose of these bones, one big purpose, is protection of the brain, because the cranium can totally encases the skull. There's only one movable bone in all of the cranium, with the facial bones and the cranial bones combined, and that is the mandible. We'll talk more next time.